Hi, my name is Selina. Today I'll be talking about smoking cessation. Smoking is a major contributor to death and disease. Tobacco smoke contains over 70 carcinogens. Key conditions associated with smoking are cancer, especially lung cancer, COPD, cardiovascular disease. Secondhand smoke can cause cardiovascular and respiratory issues. Infants and children, they can lead to low birth weight and sudden infant death syndrome. First line therapy is nicotine replacement therapy. It helps to reduce cravings and withdrawal symptoms, avoid other harmful chemicals found in cigarettes. Different types of level dependence. So the first one, high dependence, is someone who wakes at night to smoke, or they smoke within 5 minutes of waking, usually more than 30 cigarettes per day. Moderate would be smoking within 30 minutes of waking, usually 20 to 30 cigarettes per day. Low to moderate is someone who doesn't need to smoke within 30 minutes of waking, usually 10 to 20 cigarettes per day. Low dependence would be no need to smoke within 1 hour of waking, usually less than 10 cigarettes per day. Combining two forms of NRT works better than a single method. So combine a patch with a faster acting form. It's available over the counter. First one is patch. Moderate to high dependence, you may use 21 milligrams, 24 hours, or 15 milligrams in 16 hours. So this may avoid sleep disturbances. You use one a day. Recommended is up to 12 weeks. Low to moderate dependence. You may use 14 milligrams in 24 hours, or 10 milligrams in 16 hours, or 15 milligrams in 16 hours, up to 12 weeks duration. Next is gum. Another rapid acting form. High dependence is 6 to 10 pieces of 4 milligrams a day. Avoid using more than 1 piece per hour. Then you reduce it to 2 milligrams after 4 to 8 weeks. Moderate dependence is 8 to 12 pieces of 2 milligrams a day. Next is oral spray. Another rapid acting form. Use 1 to 2 sprays when craving occurs, up to 4 sprays in an hour for around 6 weeks. You gradually reduce over the next 6 weeks to 0. Next is inhalers. It's another rapid acting form. You inhale according to craving or withdrawal symptoms for 3 months. Then you gradually reduce over the 2 months. Maximum is 6 cartridges per day. So 1 cartridge equivalent to 7 cigarettes. Next is lozenges, another rapid acting form. Moderate to high dependence, you use 4 milligrams. Low to moderate dependence, you use 1.5 or 2 milligrams. Recommended dosing are weeks 1 to 6. You use 1 every 1 to 2 hours. Then week 7 to 9, you use 1 every 2 to 4 hours. Week 10 to 12, you use 1 every 4 to 8 hours. And week 12 to 24, you use 1 when strong urge to smoke. Patient counseling. Avoid eating or drinking with oral and inhaled forms. For the gum, you use it differently than a normal chewing gum. So first you chew to activate it until you feel that tingling sensation. You can feel that the taste of the nicotine, and then after that you just park it at the side, so between your cheek and your gum. And after that, when there's no taste, you repeat the process. So you chew it and then you just park it. So one piece would last you about 30 minutes. Inhaler, you use similar to cigarette. So one cartridge will last about 40 minutes. Lozenges, you just let it dissolve in your mouth. So it takes about 30 minutes to dissolve. Patch, you apply it on the upper body or outer upper arm. The area must be non-hairy, clean, dry, and you rotate the area. Spray, you aim it in the mouth at the side of the cheek or under your tongue. Next slide. So this is the initial dosing of nicotine replacement therapy. So first you assess the time to first cigarette. Then you assess the number of cigarettes smoked per day. And then the initial product recommendation. So if you smoke within 30 minutes of waking, 10 or less, then you use the 21 milligrams patch plus the gum or lozenge spray on inhaler. You smoke more than 10, then use the patch plus 4 milligrams gum or the 4 milligrams lozenge or 1 milligram spray or 50 milligrams inhaler. You just go by the diagram going down. Next, therapy is varenicline. It's a partial agonist of nicotinic receptors in central nervous system. It relieves cravings, reduces rewarding effect of smoking, so it has similar efficacy to combined NRT. It's more effective than the monotherapy NRT with bupropion. Adverse effects are nauseous, increased appetite, headache. Normal dose is 0.5 milligrams in a day for 3 days, and then twice a day for the next 4 days, and then you increase it to 1 milligrams twice a day for 11 to 23 weeks. So in terms of counseling, you have to tell them to initiate at least 7 days before stopping smoking. Take the dose with food, as it may reduce nauseous. Temporary increase in craving may occur when treatment ends. May use the fast-acting NRT if there's urge to smoke. May affect ability to drive. The next line is bupropion. Originally, it's developed as an antidepressant. It has similar efficacy to NRT monotherapy. You combine it with NRT, it has not been shown to improve efficacy. So adverse effects include insomnia, dry mouth, nauseous. It's contraindicated in history of seizure or eating disorders or patients taking an MAO inhibitor. Make sure you swallow whole, avoid alcohol, and may affect ability to drive. The next therapy is nortriptyline. Limited data suggests increased long-term cessation compared to placebo. The use is actually limited by side effects such as dry mouth, constipation, nausea, sedation, headache, arrhythmia. It's also dangerous in overdose. Next, therapy is e-cigarettes, often referred to as vaping. Long-term effects is unknown. Nicotine-containing e-cigarettes require prescription. Next, this is the diagram of the e-cigarette. Interactions. Smoking can interact with medications. Those changes may be required when stopping or starting smoking. In terms of pharmacokinetic interactions, chemicals in tobacco smoke induce CYP1A2. It leads to reduced levels of medicines metabolized through this enzyme. Smoking cessation can increase the levels of medicines metabolized by CYP1A2. It may not be relevant for medicines with wide therapeutic index. For example, caffeine. It's suggested that you reduce caffeine intake by half. So when you stop smoking. So clozapine, monitor the trough concentrations, preferably before smoking cessation and for 2 weeks afterwards. You monitor the side effects of higher serum levels, such as the sedation, hypotension. You also seek specialist advice. Dose reduction may be required. Next example, allotinib is recommended to stop smoking before starting treatment. Theophylline, monitor the plasma concentration. Dose reduction also may be required, and monitor for side effects such as palpitations, nausea, vomiting. Pharmacodynamic interactions with tobacco smoke. Corticosteroids. So patients with asthma may have reduced response. Oral contraceptives, it may increase risk of cardiovascular disease. Benzodiazepines, it may reduce the efficacy due to the stimulant effects of nicotine. Beta blockers, nicotine opposes beta blocker effects on blood pressure and heart rate. Insulin slows the insulin absorption. Question 1. Is combining two forms of NRT works better than using a single method? Question 2. Which forms of NRT work longer? Lozenges, or is it a patch, or gum, or inhalers? What are the side effects of varenicline? Nausea, headache, insomnia, or all of the above? So next is the references that you can have a look. Thank you.